Having poesia of Russian sound and maybe justice. We are now engaging with James, and this is because of our parents.
Hello, ladies and gentlemen. One more time, I ask that we take our seats in readiness for the start of our program. Please take your seats, and when the announcement is made that our guest of honor is making his way in, we'll be required to stand. And then we will sing, or the national anthem, the Zambia national anthem will be played by the Zambia Army Orchestra, to be followed by a word of prayer, and then we will take our seats and proceed with the program. So once again, please take your seats. If you haven't found where you will be seated yet, if you need help, please ask any of the ushers.
A responsabilidade de todos reflete não apenas uma aspiração, mas compromisso coletivo que cada de nós deve abraçar. Angola junta-se mais uma vez ao movimento global para acelerar a cobertura universal de saúde e depor sob o lema saúde, responsabilidade de todos.
Os benefícios da educação universal de Ruanda, os cuidados de saúde primários e imunização são o caminho mais assertivo para acelerar o alcance da cobertura universal, onde se destaca o aumento gradual na utilização de recursos e experiências.
A cobertura universal da saúde não é um sonho, é um elemento poderoso para promover a igualdade e a equidade e reduzir a pobreza. A cobertura universal é mais do que uma iniciativa de saúde, mas representa equidade, justiça e a base de estabilidade política e social. Como disse aqui a jovem menina, passou uma lição bonita. O que é que você tinha a fazer?
Nós fizemos para ter um resultado da erradicação da polio, do controle da doença até hoje.
Como você fez um bom trabalho, fez a sobre vacinação, então serás colocada no banco.
Eu preferi a iniciativa da polio e agora vou lançada.
Ladies and gentlemen, shall we rise? The Zambia Army Orchestra will lead in the Zambia National Anthem and followed by a word of prayer to be offered by Chaplain Major Charles Mutinta from the Ministry of Defense. Now, the Zambia National Anthem.
Shall we pray? Our Heavenly Father, Creator of all humanity and source of all wisdom, we gather in this place today from across the great continent of Africa and beyond, united by a common purpose, the pursuit of healthy and well-being for all people. I invoke your blessing upon this fifth session of the World Health Organization Region Committee for Africa Conference. We pray for your divine guidance to rest upon every delegate, expert, and leaders assembled here. Grant our guest of honor, His Excellency Mr. Hakainde Hichilema, President of the Republic of Zambia, and all heads of delegation, clarity of vision, discernment, and profound commitment to the sacred cause of public health. Bless the discussions that will take place in this conference. May they be marked by wisdom, collaboration, and shared sense of urgency. Inspire innovative solutions to the challenges we face, from the ancient scourges to the emerging threats. We remember before you the health workers on the front lines across our nations, Protect them, Father, strengthen them, and reward their tireless services. As we open this session, open also our minds to learn, our hearts to empathize, and our wills to act decisively for the most vulnerable among us. We ask for your blessing to be upon this conference and upon our time together. In Jesus' mighty name we pray with thanks in our hearts. Amen.
Please take your seats. The President of the Republic of Zambia, Mr. Hakainde Hichilema, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, the Regional Director for Africa of the World Health Organization, Professor Mohamed Yaqub Janabi, the Director General for the Africa Centers for Disease Control and Prevention, His Excellency, Dr. Jean Kaseya, the first Vice Chairperson of the 7th session of the World Health Organization, Honorable Dr. Louise Maple Poto, the Minister of Health of the Republic of Zambia, Honorable Dr. Elijah Muchima, MP, Honorable Cabinet Ministers here present, Honorable Ministers of Health from the continent of Africa, the Provincial Minister for Lusaka Province, Honorable Shio S. Muliata, MP, the Secretary to the Cabinet of the Republic of Zambia, Mr. Patrick K. Kangwa, represented by the Permanent Secretary Special Duties at Cabinet Office, Mr. Wisdom Walia. Her Worship, the Mayor of the City of Lusaka, Ms. Chilando Chitangala, Chairpersons of the Service Commissions, the Permanent Secretary for Donors, Ministry of Health, Dr. Sinyangwe, invited Permanent Secretaries, the Provincial Permanent Secretary for Lusaka Province, Engineer Joe Kalusa, senior government officials, members of the UPND Alliance Council of Presidents, members of the UPND National Management Committee, honorable members of Parliament, Your Excellencies, ambassadors, high commissioners, heads of missions, and members of the diplomatic corps accredited to Zambia, the District Commissioner for Lusaka, Mrs. Rosa K. Zulu, the World Health Organization Secretariat, invited guests, distinguished delegates, members of the press, ladies and gentlemen, good morning to you all. Good morning, everybody. And karibuni, bienvenue, benvindo, and a very, very warm welcome to Zambia, to Lusaka, the capital city of this country, and indeed to the Kenneth Kaunda wing of the Mulungushi International Conference Center for the 75th session of the World Health Organization Regional Committee for Africa. And indeed, we would really like to give a very special welcome to all the delegates that are coming from outside of the country, especially those that are here for the very first time, visiting Zambia for the first time in your lives. You're most welcome. And we're glad that all of you made it here safely for indeed this session under the World Health Organization. And the Ministry of Health of the Republic of Zambia and the entire government and the people of Zambia are happy and proud to welcome and receive you all here in Zambia. My name is Paddy Mugando, and I'm honored to be Master of Ceremonies for this event here. And of course, there'll be deliberations, there'll be meetings, there'll be interactions for the next few days. And so we encourage and invite all of us to participate and give it our all. We have traveled many kilometers to be here. Let's make that travel and your stay here worth your while. And so to start our program, I would like to invite our host minister, that's the Minister of Health for the Republic of Zambia, the Honorable Dr. Elijah Muchima, MP, to come and welcome us all to this session and to welcome us indeed to Zambia. Let's put our hands together for Honorable Dr. Elijah Muchima, the Minister of Health of the Republic of Zambia. For those needing translations, we have French and Portuguese. I hope we have the sets for the translations with us. So there are two channels, one for French and two for Portuguese. Honorable Muchima.
Good morning, everyone. Your Excellency, the President of the Republic of Zambia, Mr. Hakainde Hichilema. Your Excellency, African Union Chairperson, Yusuf, Ministers of Health from the World Health Organizations, Africa region, Zambian Cabinet Ministers present, Dr. Tedros Adhanom Ghebreyesus, the World Health Organization Director General, Honorable Dr. Lewis, First Vice Chairperson of the 4th session of the World Health Organization Regional Committee meeting for Africa, Professor Mohamed Yakub Janabi, the World Health Organization Regional Director for Africa, Permanent Secretaries, Minister of Health, senior government officials present, invited guests, distinguished guests, members of the press, let me simply say, ladies and gentlemen. Mr. President, I'm here both honored and privileged to welcoming you to Lusaka, Zambia for the 5th Regional Committee meeting of the World Health Organization for Africa. Mr. President, this gathering is unprecedented in the Zambian history. It brings together political leaders, policymakers, and technical experts, united by a shared commitment to advancing the healthy and well-being of our people across the African region and the entire world. This meeting will, among other things, consider health-related policies within and between countries, the World Health Organization budgets, and share lessons learned within and between nations. It has been agreed already that here we are now going to have walk the talk. Mr. President, honorable delegates, this meeting is taking place when we are at the crossroads of which where we go in quest to improve regional and global health. The way we are confronted by myriad of challenges, including the ever-changing profile of diseases, emerging medical threats, climate change, changing financial landscape, and geopolitical confrontations. Therefore, meetings such as these ones are important in galvanizing local, regional, and global solutions to mitigate these challenges. Your Excellencies, ladies and gentlemen, the complexities of today's health threats demand that we stand united. No single nation can overcome these challenges in isolation. We must deepen regional collaboration, share best practices, harness African expertise, innovation, and build long-term resilience across borders. The outcome of this session will guide our collective action towards a more secure, equitable, and sustainable future for all. Your Excellency, my colleagues, ministers, fellow delegates, once again, I extend a warm and heartfelt welcome to Lusaka. I'm confident that this 5th session will further consolidate our shared resolve to build resilient health systems, foster unity and self-resilience across the African region, and secure the health and well-being of every citizen we have been called to serve. Your Excellency, allow me to emphasize that Zambia remains dedicated to strengthening partnerships with other countries, multilateral organizations, and bilateral organizations to improve regional and global health. It is for this reason, and this is the reason alone, that we lobbied to hold this meeting in Lusaka, Zambia. On behalf of the government and people of the Republic of Zambia, I commend the World Health Organization Regional Office for Africa for its visionary leadership and tireless support to member states. Mr. President, distinguished ladies and gentlemen, let me therefore extend my gratitude to the Zambian Organizing Committee, the World Health Organization, and the sponsors for working together in making this meeting the success it is. To our international delegates, you are warmly welcome to our beautiful country and to our capital city, Lusaka. Please feel at home and take time to tour Zambia, to see our tourist sites and to experience their Zambian hospitality, such as Livingstone, the Victoria Falls. I wish you fruitful and productive deliberations throughout the conference. I thank you. May God bless you.
Thank you very much. That was our host minister, the Minister of Health for the Republic of Zambia, Honorable Dr. Elijah Muchima, highlighting some of the topics that obviously will be the center of many deliberations that will be taking place in here for the next few days. And of course, inviting you, our distinguished delegates and guests from outside Zambia, to enjoy Zambia as much as possible and stay as long as you like. Now it is my honor to invite the first vice chairperson of the 74th session of the World Health Organization Regional Committee for Africa, and this is Honorable Dr. Louise Maple Poto, to also come and deliver her remarks on this occasion. Let's put our hands together for Honorable Dr. Louise Maple Poto, the first vice chairperson of the 74th session of the World Health Organization Regional Committee for Africa.
Your Excellency, President Akani Tasheliman of the Republic of Zambia, Honorable Dr. Elijah Muchima, Minister of Health Zambia, and other Zambian ministers present, Honorable Ministers of Health and Heads of Dedication from other WHO African member states, WHO Director General Dr. Tedros Ghebreyesus, WHO Regional Director for Africa, Professor Yakub Genevieve, Your Excellency, Ambassador Ama Amwa, Commissioner of Health, Humanitarian Affairs and Social Development of the African Union, Africa CDC Director General Dr. Jane Kasai, dear colleagues from WHO and other UN agencies, valued partners, distinguished guests and members of the media, good morning. Let me start by thanking His Excellency, the President of the Republic of Zambia and his cabinet for hosting us in Lusaka, the very beautiful capital city of Zambia, and for the meticulous preparation put in place for the RC 75. I also wish to warmly congratulate Professor Yakub Genevieve on his election as the new WHO Regional Director for Africa. Your election reflects the trust and confidence that African member states have in your leadership capacity, your vision, and proven commitments to advancing public health in our region. Your manifestos, which lay out a clear and pragmatic roadmap for transforming health outcomes in Africa, is both visionary and deeply rooted in the realities we face as African countries. We are particularly happy with the alignment between your strategic priorities
and the national health agendas of most, if not all, African member states. Your focus on health system resilience, particularly primary health care revitalization, emergency preparedness, equity, and local innovation resonates strongly with our collective aspirations. I strongly believe that these priorities will be critical as we strive to accelerate progress towards the Sustainable Development Goals, including universal health coverage and the African Union Agenda 2063. As the outgoing acting chair of the RC 74, I strongly urge us all to rally behind our new regional director with a spirit of African unity and common responsibility. The challenges that confront the region, such as the ongoing cholera, mpox, and other disease outbreaks, and gaps in health financing and service delivery, require coordinated, decisive, and evidence-informed actions. It is only by working together across borders and sectors that we can build the resilient, people-centered health system our populations need and deserve. The recent shifts in the global development aid landscapes are having significant impacts on Africa's development, particularly in the areas of delivery of essential services, such as childhood immunization, prevention and control, prevalent diseases such as AIDS, tuberculosis, and malaria. Additionally, the shrinking donor envelopes and shifting geopolitical priorities continue to affect our ability to sustainably finance essential health services and scale up innovations. Addressing this situation requires bold, homegrown solutions, including innovative approaches to increasing domestic health financing, building stronger public-private partnerships, and greater efficiency in resource mobilization and utilization. We must therefore redefine what self-reliance and sustainability means for Africa's future. Furthermore, breaking the sustained transmission of current disease outbreak on the continent requires building continental capacity and instituting more focused strategies to strengthen surveillance, laboratory, data management, contact tracing, vaccination, case management, risk communication, and community engagement using the One Health approach. Such an approach should holistically address the interconnectedness of human, animal, and environmental health to promote sustainable health outcomes and strengthen early detection and response systems across all sectors. We also not forget the urgent need to address the growing impact of climate change on public health. In this regard, we welcome the recent adoption of the Pandemic Accord at the 78th World Health Assembly and call for urgent and coordinated efforts to collectively negotiate the outstanding article, sign, ratify, and effectively implement it in the region. I am confident that under the leadership of Professor Janevi and with genuine collaboration amongst African member states, partners, and communities, we will rise to the occasion. It is my belief that Africa has most of the required tools, the knowledge, and the collective will, which we now have to match with sustained action and political commitment. As I pass on the baton, I reaffirm Liberia's continuous support for WHO Afro and the regional director's vision. I wish us all a productive and forward-looking RC 75 section. May the deliberations of this week catalyze practical, and feasible actions that will transform lives and strengthen our health system for generations to come. Thank you. Merci. Obrigado.
Thank you very much. Merci beaucoup. I was the Honorable Dr. Louise Maple Poto, the first Vice Chairperson of the 74th session of the World Health Organization Regional Committee for Africa. And we thank you for your leadership, ma'am, even as you prepare to hand over your role. The Director General for the Africa Centers for Disease Control and Prevention, His Excellency Dr. Jean Kaseya, will be the next one to address us this morning. And let's welcome him now as he comes with a round of applause. Dr. Jean Kaseya, the Director General, Africa CDC. And I hope we've been able to find the channels for the translations. If not, channel 1 is English, channel 2 is French, and channel 3 is Portuguese. Dr. Kaseya.
Good morning, Your Excellency Hakainde Hichilema, President of Zambia and AU champion for cholera. My brother, Dr. Tedros, Director General of WHO. My brother, Professor Janabi, Regional Director of WHO Afro. My best friend, Elijah Muchima, Minister of Health in Zambia and Chairperson of the Africa CDC Governing Board. African Ministers of Health, ambassadors, dear colleagues and friends, I want to express my joy to be today in Lusaka, coming from Japan, because it's every day a pleasure to come to see how Your Excellency is leading this country as a Chief Executive Officer, making huge transformation even in the health sector. The second reason I'm here, because this is the first regional committee of my brother, Professor Janabi. In my culture, we have to say, when there is a wedding, no one can be well dressed than the person getting married. Today is your day, and we are here to celebrate you. Thank you. Excellencies, independence cannot be real if a nation depends upon external gift. This wisdom is not from Jean Kaseya. It's from President Julius Nyerere. That is resonating more than ever. For our continent, autonomy and sovereignty are not abstract ideals. They are the foundation that must be built on true solidarity and true unity. Let us talk about solidarity and unity. We saw in another continent leaders coming together to unify their voice and negotiate what they called a fair tax agreement. They got the same tax agreement for all countries of the continent. In this continent, we saw leaders coming together without invitations, going to attend a meeting with another strong and powerful person to discuss their own interests. What are we doing in Africa when some of our countries are facing huge tax issue? What are we doing in Africa when some of our brothers and sisters, they have to deposit $15,000 to secure a visa? Where is our voice as Africa? Where is our unity? Where is our solidarity? We need, and we know that Africa cannot win if we continue to work in isolation. Unity and solidarity are instruments of our common survival. Excellencies, 1 year ago, I declared Mpox as public health emergency of continental security. Together with WHO, we established and co-lead the IMST, the Incident Management Support Team, bringing together 30 partners to successfully support our affected countries. IMST today has become a model of partnership and delivery, now leading the response to cholera. For all of outbreaks we are facing in Africa, we have two major challenges. The first one, lack of medical countermeasures, and the second one, lack of sustainable financing. Each year, Africa is losing over $240 billion importing health commodities. Even when money is available, access remains uncertain. We are making progress in local manufacturing, and I want to welcome my friend Peter Sands and Global Fund for their commitment to combine the African pool procurement mechanism adopted by African head of state in 2025 with WAMBO mechanism to secure affordable and high quality first African-made product. This is the only way when we give market to African product that our agenda of local manufacturing can move on. Solidarity requires also responsibility. Why are we still not contributing the modest $100,000 per country to operationalize the African Medicine Agency? Third, regulation is not Africa CDC mandate. Even when Africa CDC didn't secure any fund for AMA, we stepped in to support AMA, even paying for the past 8 months the salary of Dr. Benjamin as the acting director general, who's a staff of Africa CDC, to cover this position while we are waiting for African countries to contribute and to give the contract to the new director general of AMA. Let me say it, as DG Africa CDC, Africa CDC should be congratulated by supporting AMA, not challenged it. We need to act now because AMA is part of our agenda for regulation and local manufacturing. I want to engage you ministers to take action with your government to provide funding to AMA. Excellencies, financing remains our greatest challenge. In February 2025, President Kagame led a meeting bringing together 12 heads of state, warning around ODA dependency and called for sovereignty that led for the vision that head of state adopted during the AU Assembly with the Green Book that we call Rethinking Africa Health Financing in a New Era. This Green Book is the most comprehensive framework Africa has produced to reclaim ownership, leadership, and sovereignty of our health system. President John Mahama has since reinforced this message during the meeting that took place in Accra last month. I had the opportunity to meet President Mahama in Japan and to congratulate him for that. Progress is made in several countries, like in Zambia. President, I have to applaud you for moving from 7% to 12% from 2021 to 2024, the contribution of the national budget to the health sector. So many other countries are making progress. Ministers who are here, they will have opportunity to share that. I was talking with our champion of domestic financing, and President Kagame just shared he will be calling very soon for a high-level meeting to accelerate action. This meeting will take place in Kigali in a couple months. To support our countries, Africa CDC, listening from ministers, is advertising next week 10 positions of public finance management specialists to support the national reforms in 10 priority countries. We are supporting this Lusaka agenda. I have to say every day, Lusaka agenda is essential, is vital for us because Africa's sovereignty through partner alignment is what we want. Never again. Never again should Africa accept programs imposed outside our priorities and outside ministers' leadership. Africa is fully backing replenishment of Gavi, Global Fund, Pandemic Fund, and Green Climate Fund. I commend Gavi for the successful replenishment. We just come from Japan, where Japan committed $550 million, closing the gap that we still have. I want also, on my capacity, to congratulate my sister Sanya, I think Sanya must be somewhere, the CEO of Gavi, for the Gavi Leap that we are celebrating yesterday with a number of ministers. That is the vision that we want in Africa of alignment and respect. Excellencies, peace and health cannot be separated. Epidemics thrive in conflict. That is why Africa CDC worked to integrate health into the peace agreement signed between Rwanda, DRC, with support from the US. I want to thank President Kagame, President Tshisekedi, and Ambassador Boulos, representing the White House, and Marco Rubio for accepting to receive the Africa CDC document as part of this peace agreement. This will channel around $3 billion into investment in health security for the region, not for only 2 countries, for the region. And this investment includes also Zambia. That proves that peace without health is fragile, and health without peace is unsustainable. To finish, our leaders, head of state of Africa, they decided to bring and to empower Africa CDC to become the public health agency of Africa, leading the agenda of pandemic preparedness and response, local manufacturing, and financing, among others. They have also appointed champions, President Ruto for reform and local manufacturing, President Kagame for financing, President Ramaphosa for pandemic preparedness and response, President Tinubu for health workforce, and President Ichelema, I have to call him HH, for cholera response. These are not symbolic roles. These are not symbolic roles. They are acting. They are acting because a couple months ago, President Ichelema called for a meeting of head of state coming from countries affected by cholera. 20 countries were there, around 15 head of state and prime minister attended. Tomorrow, President is so kind. Despite his busy schedule, you accept His Excellency to launch the Continental Cholera Response Plan. That is the tool that we need in our continent to respond to this cholera outbreak. We are all committed to stop cholera by 2030. Excellencies, Africa has the vision. Africa has the champions. Africa has the institutions. Africa has the people, even resources. What we need, and we need to commit that today, is true solidarity and true unity. Our people demand us to come together. Our history demands no less, and our future will forgive nothing less. I thank you.
Thank you very much, Your Excellency, Dr. Jean Kaseya, for that call to action and also a call for unity and solidarity in the African continent in the health sector. Ladies and gentlemen, I will now ask that we turn our attention to the video screens that are in front of you for a message from His Excellency Mahamudu Ali Yusuf.
Health emergencies and ensure equitable access to quality health services for all. On behalf of the African Union, I commend the WHO Regional Office for Africa for its unwavering leadership and strong collaboration among the states and partners. Partnership between WHO, the African Union, and our continental institutions is vital in driving impactful health outcomes and strengthening systems that serve all Africans. This means the directions from strengthening health systems and rehabilitation services to addressing malaria, polio, maternal child health, as well as non-communicable diseases are fully aligned with our priorities under the Africa CDC's new public health order. We are encouraged.
Thank you. And that was His Excellency Mahamudu Ali Yusuf, the African Union chairperson, commending all the efforts that have been scored so far on the African continent and urging us to do more for the people of Africa. With that now, I will go on to invite Professor Mohamed Yakub Janabi, and he is the World Health Organization Regional Director for Africa, to come and give us his remarks. Let's put our hands together for Professor Janabi, WHO Regional Director for Africa.
Your Excellency Hakainde Hichilema, the President of the Republic of Zambia, Honorable Dr. Elijah Muchima, Minister of Health of the Republic of Zambia, Honorable Ministers from the Cabinet of the Republic of Zambia, Honorable Ministers of Health and heads of delegation from member states, Dr. Tedros Ghebreyesus, WHO Director General, Your Excellency, she's not here. Your Excellency, Dr. Jane Kasaya, Africa CDC Director General, Honorable Ambassadors, valued partners, dear colleagues from the UN agencies, distinguished guests, the media team supporting this important event, ladies and gentlemen, good morning. Muli bwanjo. It's both a great privilege and profound honor to welcome you to the 75th session of the WHO Regional Committee for Africa here in Lusaka, Zambia. It is both an honor and deeply humbling experience to stand before you today, just 7 weeks into my tenure as a regional director for WHO Afro, and my very first regional committee. This milestone comes at a time when our continent, our organization, and indeed our planet are navigating a wave of profound and unprecedented uncertainties. Financial models are shifting. Geopolitical tensions are rising. Climate change is accelerating. Health systems are strained. Antimicrobial resistance is growing, a slow motion pandemic on its own. Yet, in the face of these challenges, I stand before you with unwavering hope. Why? Because I believe in you. Because I believe in Africa. I believe in our collective strength. I believe that together we can and we will transform the future of health on this continent. As Maria Correa once said, now is a time to understand more so that we may fear less. Let this session be a space of understanding, courage, and transformation. I extend my heartfelt gratitude to Your Excellency, the President, the Honorable Minister of Health, and the people of Zambia. Your visionary leadership, active engagement, and unwavering support in preparing for this session have been truly, truly pivotal. Zambia achievements in health are not only commendable, they stand as a beacon of inspiration across the continent. From convening the heads of state cholera control summit earlier this year to pioneering local manufacturing of cholera vaccine, Zambia is showing us what visionary leadership looks like. You increased your investments in health from 2021, which was only 8%, today stands at 12%. Is a key step towards the Abuja Declaration target and the Lusaka agenda. And your progress on maternal mortality is a beacon of hope. It is a testimony that we can reach the SDGs by 2030, not in theory this time, but in practice, and where here in Africa. Zambia achievements prove that with political will, strategic investments, and community-driven solutions, we can save lives, empower women, and build healthier future. These are not just national milestones. They are blueprints for regional progress. I congratulate you, Mr. President. I take this opportunity to convey my profound gratitude to the chair of the 74th Regional Committee for Africa, Honorable Mr. Gilbert Mukoko of the Republic of Congo, for his outstanding leadership and service. And to Honorable Dr. Louis Mapel Porto, Minister of Health of the Republic of Liberia, for presiding over the second special session of RC earlier this year. We benefited from your leadership and availability throughout the year. Distinguished leaders and colleagues, in my first month as regional director, I had the privilege of engaging with many of you, listening to you, learning from you, and witnessing your resilience. I spoke with many of you over the phone. The Minister of Health of Ethiopia on the polio challenges in the Horn of Africa. Cabo Verde, they had floods recently. I had a call. What can we assist? Madagascar had an outbreak of botulism. WHO was there. We took experts there and the antitoxins which are needed. We spoke with Burundi minister. There was a mild earthquake there. I had an opportunity to speak over the phone with the Minister of Health of Senegal about climate change. I spoke with the Minister of Central Africa about budgeting and transformation in his country. I had a talk with the Minister of Seychelles about how can we engage more the small islands. Physically, I visited DRC when there was an outbreak of cholera, giri-giri. Apart from sending assignments from WHO, but to discuss how long can we continue to have cholera? It's just a pure hygiene wash. Can we involve other ministers? I've been in Ethiopia, Ghana, Republic of Congo, Tanzania, and now I'm here in Zambia. You told me what matters most in your respective countries: delivering impactful results, expanding access, building systems that save people. These conversations are shaping our priorities, and they have shown me something powerful. Africa is ready, not just to participate, but to lead. Yes, our challenges are complex, but they are not insurmountable. As Nelson Mandela reminded us, it always seems impossible until it's done, and we are doing it. And Africa is. I promise, during my time, I will reach all the rest of the countries which have not been there, to listen to your priorities and to attend them with courage, clarity, and conviction. This transformation will require more than WHO. It will require all of us. The African Union, the regional economic communities, Africa CDC, AMA, UN agencies, NGOs, our partners, financial institutions, religious communities, civil servants, the private sectors. Let us all join hands in improving our people's health. We are building the same house. Let us not fight for the bricks. We are living through a time of global transition. Trusts in multilateral institutions is being tested. Some nations are stepping back, but Africa must step forward. Our voices must be clear, coordinated, and courageous. Here in Zambia, when I was still little, I used to hear, "One Zambia, one nation." WHO has something to learn from this slogan. All of us have something to learn from this slogan. We must lead the call for global health architecture that is accountable, transparent, and responsive to Africa realities. This is not just about inclusion, it's about influence. Our shared agenda in changing world. At the heart of WHO's work is the 14th General Program of Work, our roadmap for the future. But, honorables, ambition alone is not enough. We need a sustainable, flexible funding to turn plans into progress. That's why WHO Afro first ever investment round endorsed a year ago is very, very, very significant. I'm standing here, I'm proud that 21 member states have pledged, showing that Africa is not a passive recipient, but a proactive partner in global health governance. Thank you all for stepping up. Let's continue to lead and let us own our health, not merely as a priority, but as our shared obligation. WHO remains fully committed to support member states and is prepared to lead where leadership is needed. We are also innovating in how we deliver impact. The 75th Regional Committee is the first ever 3 days format designed for efficiency and impact in today's resource-constrained environment. Over the next 3 days, we will tackle the issues that matters most: health and well-being, strengthening our health system, advancing our health security and preparedness, eliminating preventable diseases like cholera and polio, discussing innovative domestic financing. This should be our backbone. These are not just abstract goals. They are urgent imperatives, and they demand bold, actionable decisions. As I outlined in my manifesto, we must reframe health not as a cost, but as a cornerstone of prosperity. We must build systems that are efficient, inclusive, resilient, sovereign, preparedness and response, and building our workforce. And we must place people, especially the most vulnerable, at the center of every policy, program, and partnership. In closing, I again express my deepest gratitude to the government of Zambia, under your leadership, Mr. President, for your generous hospitality and continued support. To all member states, our partners, colleagues who have gathered here today, and those who are online, thank you for your steadfast commitment to our shared mission. Colleagues, let us remember, we are not just responding to challenges. We are shaping the future of health in Africa. Let this be a moment of renewal, a moment to reaffirm our shared commitment to equity, to innovation, and to health and dignity of every African life. Together, I believe we are stronger, together we are smarter, and together we are unstoppable. Thank you for your presence, your partnership, and your unwavering belief in the promise of our continent. May this gathering ignite bold ideas, courageous actions. Let history remember this moment not as just a meeting, but a movement. And Africa, now is a time of implementation. Thank you, merci beaucoup, obrigado. Mr. President, zikomo kwambiri. Thank you.
Thank you very much. That was Professor Janabi, the World Health Organization Regional Director for Africa. We thank you, sir. And indeed, congratulations on your new appointment. And we wish you well as you fulfill your mandate in this, your new role. And of course, Zambia is happy to host you on this, your inaugural session. Ladies and gentlemen, it is my privilege and honor to now introduce and invite the Director General for the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, to address us. Welcome, sir.
Your Excellency, President Hakainde Hichilema, Honorable Chair, Minister Elia Muchima, Vice Chair, Honorable Minister Dr. Luis Poto, Honorable Ministers, Heads of Delegation, Regional Director Dr. Mohammed Yaqub Janabi, Africa CDC Regional Director John Kasea, dear colleagues and friends. Good morning. Bonjour, bom dia. It's an honor to be back in Lusaka. I don't know how many times I have been here, but my first is to Ndola in 1995. And still a fresh memory about Ndola. And I tell my Zambian colleagues I'm from Ndola, the Copper Belt, because that was the first visit to Zambia. And thank you always for the great hospitality. Thank you so much. And I thank Your Excellency, your government, and the people of Zambia for your hospitality in hosting this year's Regional Committee for Africa. And I commend you for your continued commitment to promoting, providing, and protecting the health of your people. I am especially pleased to note that the maternal mortality ratio in Zambia has declined by 14% since 2020. At a time when maternal mortality remains stubbornly high in many countries, this is an impressive achievement, and congratulations, Your Excellency. I'm also pleased to see that Zambia is on track to exceed the Abuja target for health financing, as my brothers John Kasea and Janabi had already said, and has made significant progress in strengthening its health workforce with almost 20,000 health workers recruited in the last 3 years. You're also transforming health digitalization under the Smart Zambia Institute. I also thank you, Your Excellency, for your leadership and your commitment as a cholera control global champion. This regional committee is also significant as the first in a new era under the leadership of Professor Janabi. My brother, congratulations once again on your election. You have taken the helm at an unprecedented and extremely tumultuous time for WHO. We're grateful for your experience and expertise as you have navigated these challenges. Although you have only been in the job for a few weeks, thank you for the commitment, energy you have brought to it, and for your first report. As you wrote in your report, despite the turbulence of the past year, WHO has worked to meet the challenges you face. The regional office responded to over 160 public health emergencies, rolled out malaria vaccines in 19 countries, and strengthened health financing in 80% of your countries. 5 countries were validated for the elimination of at least one neglected tropical disease. Millions of children were protected through immunization and nutrition programs, and much more. As you know, our continent faces many challenges. Maternal and child mortality remain high in many countries. Progress against HIV, malaria, and TB has stalled, in some cases reversed, while the burden of non-communicable diseases and mental health conditions only continues to increase. Every year, we face health emergencies caused by outbreaks, conflict, or climate-related weather events. And despite the undeniable progress we have made, health systems in many countries remain inadequate to meet these challenges, with uneven service coverage, high out-of-pocket health spending, and underpowered health workforce. Even in the face of financial and organizational challenges, the regional office has continued to deliver world-class technical support to our member states. Your agenda this week reflects